Okay, hi everyone. Today I'll be teaching my 70-year-old patient, Sat, how to self-administer her eardrops. I will know my client teaching was successful once my client successfully demonstrates the proper way to self-administer her eardrops in the right ear. Hi.
Hi.
My name's Maria. I'll be your nurse for today, and I'm here to show you a little demonstration about these eardrops that you'll be getting, okay?
Okay. Why am I getting an eardrop?
So the reason that you came into the clinic was because you were having some ear pain, and from further evaluation, it turns out that you have an ear infection.
Okay.
So we're going to give you some eardrops to help with the pain, okay?
Okay.
Does everything make sense?
Yep.
With that? Okay, perfect. So the eardrops will help treat the condition, and it'll help relieve the pain.
Okay.
And hopefully in about 3 to 5 days, the pain should be gone. But
Perfect.
first things first, I'm going to show you how to do the eardrops, okay?
Okay.
We're going to start off with washing hands. It's very important to wash hands. Even though the eardrops are going into your ear and not your eye, you could still cause an infection or, just make the ear infection worse.
Okay.
So we're going to wash our hands.
Yeah.
And obviously dry them. And then with your hand, we're going to warm up the eardrop bottle. It's a lot better if the drops are warm than cold. It just causes, if they're cold, it causes discomfort, and sometimes you can get dizzy from the cold drops.
Okay.
And then we're gonna lie down. So pretend we're at home. We're gonna either lie down on the bed or couch.
Okay.
And we're gonna lie on the opposite side of your ear that you're getting your drops into.
Okay.
So if we're getting eardrops in the right, you'll be lying on your left side, so that your ear is up and visible. Okay. And then we're gonna hold the dropper above the ear canal. But before you do that, you're gonna gently pull the outer ear upward.
Okay.
So let me pull my ear back. We're gonna pull upward, and then we're gonna pull up and back, okay? So that the ear canal is open. And then we're gonna open the dropper, obviously, and then we're gonna drop an eardrop in the ear canal, squeeze it, and then you'll feel the drop in. We're gonna lie there for a little bit so that the liquid goes down.
Okay.
And then once you stay there for maybe about like a minute or two, you can lie back up.
Okay.
And then you could just put the cap back on and then just wash your hands. And then hopefully, the eardrops will do its stuff, and then your ear infection will go away.
Perfect.
Does everything sound understandable?
Yes.
Okay, can you give me a quick little demonstration?
Yes. So first I'm going to wash my hand, and then I'm gonna lay down the opposite way of whichever I'm getting the eye drop in. So on this eardrop I meant. In this situation it will be on my left ear. So I would lay down on my right, and I'm gonna pull my ear up and then back so my ear canal is open. And then I would take my eardrop and then drop it in my ear. And I'm gonna wait like a few minutes, you said?
Like a minute.
Okay, I can wait, and now I'm gonna wait a minute, and then so that the eardrop can just go into my ear, and then after that, I can get up again, close the eardrop, and then wash my hand.
Correct. Yep. Okay, so it appears that you understand. I'm gonna go put in the prescription and just ensure that we did all the correct documentation and teaching, and then you can be on your way home, okay?
Perfect, thank you.